You should floss, you're often told. In today's Health Watch, there's growing evidence that when you floss, your oral health improves. It's beneficial for not only your mouth, but your heart and your brain. This got me. Overall, our mouths have a lot of bacteria, 700 different individual species of bacteria, and researchers found a potential link between some of that bacteria and Alzheimer's disease. And people with poor dental health are possibly more at risk. Not good. CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, joins us now. Dr. Gounder, I was flossing skeptical for years. I'm now a full convert. Have been for more than a year now. My dentist is very happy. What's this connection, this link between flossing and brain health?
Well, you think about what is poor gum health, poor dental health. It's really a bacterial infection. That's what they're also cleaning when you go see the dentist. They're removing plaque and bacteria. Bacteria, you have chronic inflammation, chronic infection, chronic inflammation. We know that chronic inflammation increases your risk for heart disease, for cerebrovascular disease, so brain disease. And so it's really important to control these things. Now, in addition to the chronic inflammation, that also increases amyloid in the brain, which we know is connected with Alzheimer's.
And amyloid is like a
It's
particles.
a protein kind of plaque that you get in the brain. The bacteria that are associated with gum disease produce enzymes which can be directly toxic to nerves. And in addition, they weaken the barrier between the blood and the brain, and so that allows for other toxins and other bacteria to enter the brain as well.
So even though we're talking about bacteria in the mouth, there's a direct connection between the brain and the heart because it's carrying this bacteria in the bloodstream? Is that what's happening?
Right, so what's happening is when you have gum disease, when you have dental problems, the bacteria in your mouth are getting into the blood, and then from the blood, they can travel anywhere, including the heart, including the brain.
Dr. Gounder, I am not a good flosser, and it's one of the things I really need to improve about myself. Can using mouthwash be as effective, or those like water pick things that spew water?
Water picks are better than nothing. Mouthwash is not a substitute because what you're really doing is mechanically removing the bacteria and some of the plaque that is building up between the teeth, and there's really no replacement for something like flossing.
But if you watch a mouthwash commercial, they'll tell you 99.999% of bacteria killed.
Yeah, I've seen those commercials.
Right, but within the plaque, you can still have bacteria. So they're only getting some of the surface stuff, not all of the stuff that's building up in between.
So talk about the heart connection. How does it go from mouth to heart?
In fact, this used to be one of the most common ways people would get heart infections.
What?
Yes. So very.
Brian right now.
My husband is like,
Cardiologist's husband is like, yeah.
his dental health is on point. Like
See,
every night
he
he gets up to brush his teeth, and
Cardiologists
I'm like,
know, because what would happen is you'd have dental infections, the bacteria would spread through your bloodstream, would infect your heart valves, and cause heart failure. So this was something we saw a lot before before we had antibiotics. So back in the 1800s and so on, this was not an uncommon thing to see.
So do you floss once a day, twice a day, after every meal? How often?
The recommendation is once a day,
Okay.
but if
what
you're
about
somebody,
you, Dr. Gounder? Come on.
I once a day
Good for you.
before bed. But if you have dental problems, if you're somebody who has gingivitis, receding gums, if you're somebody who has diabetes or heart disease, you may actually want to floss twice a day.
This is so important. So many people are affected by Alzheimer's disease, and if there is something, obviously being healthy, exercising, all helps, but flossing, who knew?
Yeah.
I'm gonna go buy some new flossing tools.
You got to get on it, really.
It's just the whole thing, and even the pick.
You clearly have healthy teeth, but you're skating on good genetics.
I know,
You
I
need
gotta
to
get on it.
taking care.
My mom told me, she's like, have you made a dentist appointment? And I was like, I will. Anyway. Dr. Gounder, thank you so much.